this webinar is going to cover the basics and best practices of smoke-free multi-unit housing policies for rental housing and common interest communities. In addition to presenting pointers on the adoption and implementation process, speakers will describe ways to ensure that policies are equitably enforced and provide residents the greatest protection from exposure to secondhand smoke. If you could advance to the next slide, please. So Rachel Callanan and I are both senior staff attorneys with the Public Health Law Center, and I'm going to give you plenty of information about our organization, so I want to say more about our guest presenter. Kara Skahen is the program director of Live Smoke Free, a nationally renowned smoke-free housing advocacy program of the Association for Nonsmokers, Minnesota. Since 2011, she has worked with the Live Smoke Free team to promote, implement, and equitably sustain smoke-free housing initiatives, both locally and nationwide. Ms. Skahen received a Master of Social Work and a Master of Public Policy degree from the University of Minnesota, Twin Cities. Next slide, please. The Public Health Law Center is located at Mitchell-Hamlin School of Law in St. Paul. We're a dedicated team of attorneys, policy analysts, and support staff who work nationwide on public health policies in the areas of commercial tobacco control, healthy eating, active living, and health equity. This is our commercial tobacco team. The Public Health Law Center is located at Mitchell-Hamlin School of Law in St. Paul, Minnesota, and we think it's important to acknowledge that that is in the Bdote region of the traditional homelands of the Dakota people. We recognize that the land we currently occupy comes with a legacy of genocide and trauma caused by US law and policy applied to American Indians. Now, when we're working with policy, we have to remember that people are differently situated, and the same policy approach may have different effects for different groups of people. Smoke-free affordable housing policies are one example. If a policy increases housing insecurity among people of low socioeconomic status, then it is not effective from an equity standpoint. Next slide, please. Housing is one of the crucial social determinants of health. Stable housing is one linchpin to aligning other social determinants of health. So the last thing we want to do is put people's housing in jeopardy with implementation of a smoke-free policy. That's why most policies ensure that eviction is truly a last resort if it's used at all. The presenters will discuss enforcement plans that will help preserve housing stability for all multi-unit housing residents. Next slide, please. Today, we will be using the term commercial tobacco, and you will see the term commercial tobacco frequently used in Public Health Law Center resources. There are very important cultural considerations when forming commercial tobacco control policy that respects the sacred nature of tobacco as it may be used for prayer, offerings, and purification. We strive to respect these important differences in the way these products are treated in our model policies and throughout our work. And our work is done through legal technical assistance, and that's distinct from legal representation. So what you'll hear from our presenters today does not constitute legal advice. If you have a specific legal question, you should contact an attorney that is licensed to represent you. But the things we do are more general in nature than dealing with specific facts of a legal case. So that can include legal research into complex legal issues, policy development, as long as it doesn't cross the line into lobbying. We have lots of publications on legal topics available on our website, and we do trainings like this one, both in person and by webinar. The things we don't do are directly represent clients or provide legal advice, and we don't lobby elected officials. Next slide, please. So this is the second short webinar we've had on smoke-free housing. We had one focusing on affordable housing last week, and that's archived on your website if you were not able to catch it. Next slide, please. We have lots of resources on various housing topics available on our website, and you can see a bunch of them here, but our website is publichealthlawcenter.org. So with that, I'd like to turn it over to our first presenter, Kara Skahen.
Hello, everyone. Good morning, good afternoon, depending on where you are. Really wonderful to have such a great crowd today. Stephanie, yep, thank you. I was just going to ask you to advance the slide. Very briefly, my program, Live Smoke Free, a program of the Association for Nonsmokers Minnesota. We are a nonprofit based in St. Paul, Minnesota, which is one of the Twin Cities with Minneapolis, if you aren't familiar. Our goal, we want to make sure that everyone has access to clean, safe, healthy, and smoke-free air where they live. I also, like Public Health Law Center, want to acknowledge that our office is also located on the traditional homelands of the Dakota people. We have a couple of websites I just want to highlight. My colleague Jackie has graciously agreed to include some of our resources that I think will be helpful in the chat box. So please take a look for some of those resources in the chat box. But I just want to draw your attention to our main website, mnsmokefreehousing.org. And also our sister website, smokefreepublichousingproject.org. We have a lot of great resources for public health professionals, property managers, residents. So please check out all of the really great resources, everything from building and maintaining a smoke-free multi-unit housing program, how to work with the housing industry to implement policies, how to work with residents who are being exposed to secondhand smoke. So really great resources, which we don't have time to get into today, but please check out our websites. Next slide, please. I just want to highlight smoke-free housing is a growing trend. So here in Minnesota, our program began in 2007, and at that point in time, we knew of 50 apartments that didn't allow smoking voluntarily. As of this year, we now know of over 5,000 properties that don't allow smoking. That includes over 48 common interest communities like condos, townhomes, and cooperatives. Nationally and internationally, there are over 84 smoke-free housing ordinances at the city and county level that don't allow smoking indoors. Many folks are familiar with the Department of Housing and Urban Development implemented a rule in 2018 that does not allow smoking in all public housing nationwide. So this is a quickly growing landscape, and smoke-free housing is in high demand currently. Recent studies have shown that in Minnesota, over 90% of Minnesota adults already do not allow smoking in their home. And so the trend is really going for people are looking for smoke-free housing in their home along the housing spectrum. Next slide, please. There are a lot of benefits to going smoke-free. We are not going to get into all of these today. I just wanted to highlight a few. Again, we're talking about healthier, safer, cleaner living for everyone in the building. So that's staff, residents, guests to the property, pets, really healthier environment for everyone. There are definitely substantial market advantages, both for property owners, management companies, but also homeowners and common interest communities like condos and the resale value. Again, there is an amenity, smoke-free housing is an amenity that people want and are willing to pay more for that. Reduced cleaning costs. It costs less to maintain and turn over units that do not have smoke residue built into the walls and have not been impacted by secondhand smoke. There's reduced fire risk, reduced legal liability. You'll hear a little bit more about that. Fewer complaints from residents. We're seeing increasingly that insurance companies are embracing smoke-free housing and willing to offer discounts on some of their rates for having a smoke-free policy. And also it eliminates any costs associating with needing any ceiling or ventilation treatments due to secondhand smoke. So again, a lot of benefits. We're just going to cover those briefly, and next slide, please. I think most of us know that secondhand smoke is harmful. I'm not going to belabor this point. So secondhand smoke, that smoke that comes off the tip of a lit cigarette, contains over 7,000 chemicals. 70 are known toxins to humans, so very harmful. The US Surgeon General has concluded that there is no risk-free level of secondhand smoke exposure. So if you can smell it, it is harmful for you. I also just want to highlight briefly that third-hand smoke. So all of those thousands of chemicals that land in and around the smoker don't just disappear. So that residue that's left behind, the term for that is third-hand smoke. And that third-hand smoke can actually combine with other airborne particles to form carcinogens, damage DNA, and lead to cancer. So again, another benefit of a smoke-free policy, you're not only removing that second-hand smoke, but you're also removing that third-hand smoke. Next slide, please. A common question we receive is, can't I just, stick a towel under the door and not have to deal with, implementing a smoke-free policy? Unfortunately, secondhand smoke transfers pretty easily from unit to unit within multi-unit housing. Approximately 1/3 of all residents in multi-unit housing is involuntarily exposed to secondhand smoke in their own home. Local research we've done here with a local engineering firm in Minnesota has shown that up to 60% of the air that a resident in multi-unit housing breathes is actually shared with your neighbor. So pretty substantial, and again, virtually impossible to seal up all of the tiny little cracks within an apartment building. Next slide, please. I just want to highlight too, we're still in the throes of a global pandemic. We're still learning about the connections between smoking, secondhand smoke, and coronavirus transmission. But I do want to highlight what we do know: secondhand smoke causes underlying health conditions, which is definitely a risk factor for more severe COVID symptoms. And secondhand smoke damages the immune system, which is a risk factor for more severe COVID symptoms. So again, we want to remove any potential cause for additional concern at this time during the COVID-19 pandemic. Next slide, please. So we're going to just touch real briefly today. We don't have a lot of time, but some different avenues for adopting policy within multi-unit housing. So again, we're talking about both rental multi-unit housing and then also owned multi-unit housing like condos, cooperatives, and townhomes. So there are really two avenues. One would be a private or a voluntary policy. So this means that the owner of a property decides to implement a policy for that property. So that could be, just the insides of the property, or that could be curb to curb. Another route that a number of communities are taking is public policy. So this could be at the city, county, or state level. And we'll talk a little bit more about that in just a minute here. Next slide, please. So as far as private or voluntary policy adoption, and you heard me mention earlier that in Minnesota, we have voluntarily gone from 50 policies to over 5,000. So very substantial, and that's due to a lot of efforts, but largely due to public health efforts on the ground, working directly with property managers and property owners. As far as rental communities, there tends to typically be one decision maker. So that could be, for a smaller property, that could be, the owner of the property, or it also could be a management company or the manager of the property. So rental multi-unit housing, it tends to be a little bit easier to implement a smoke-free policy in those settings because there is only one decision maker. Also in rental communities, the lease structure determines implementation. So this could look like a phased-in approach, whereas residents re-sign their lease addendum, that policy then becomes effective at that time for that unit. Or it could be, again, depending on the lease structure, where the entire building goes smoke-free if they have, for example, a month-to-month structure. So a little bit more straightforward in rental communities. When we're talking about common interest communities like condos, townhomes, or cooperatives, so these are communities where the unit has an individual owner. So there are many, many owners. I like to talk to grantees to think about these types of buildings like mini democracies. So it takes a little bit more on the ground organizing to get those policies passed. So again, there are many decision makers in some properties, as many decision makers as there are owners. And it's really the association documents that determine how those policies are going to be adopted and implemented. I think we'll talk a little bit more about this moving on, but there's really two avenues for adopting policies in common interest communities. One is through the declaration and bylaws. And so that would involve a vote of the entire association, so all of the homeowners, or that would be a vote of the association board. So usually just a simple majority. Next slide, please. As far as implementation, again, this varies both in rental and common interest communities. In rental communities, that policy implementation is typically implemented and enforced by the manager or the owner of the property. Rachel will be talking about this more later on. We really emphasize a graduated enforcement approach, both in rental communities and common interest communities, as we want to make sure that we're preserving housing, we're keeping people in their housing, but that we're also promoting clean air for all. My colleague Jackie will be putting some resources, as I mentioned, in the chat. We have a lot of resources at our organization that help walk properties through the process to go smoke-free, both in rental and common interest communities. In common interest communities like condos, the policy is implemented and enforced by either a management company, if there is a management company, or the community association. And I think with that, I will pass it over to Rachel.
Great, thanks a lot, Kara. So I'm going to take a deeper dive into the key elements for a comprehensive smoke-free voluntary policy and how to structure the policy in the best way to promote compliance. So in our next slide, First, I just want to highlight a few publications for you. We do have some model policies. You'll see here our model condo policy and model lease addendum. These were created specifically for Minnesota. So they are generally instructive for other states and jurisdictions, but if you choose to use these, you would definitely need to double check to make sure they are tailored, or whatever agreements you end up using are tailored to fit jurisdictions outside of Minnesota. And then the third document that I pictured here is our equitable enforcement document. And this focuses on options and the rationale behind graduated equitable enforcement in the context. So next up, this outline depicts the key components for properties. And this applies both to common interest communities and rental apartment multi-unit housing. And these elements really are key to comprehensive and strong policies. So I'm going to walk through some of them. We don't have time to get through all of them today. But what existing state or local laws apply in the context in your jurisdiction? Who will the policy apply to? The what of the policy, what products are covered, and the where. So on the next slide, diving a little deeper into the who, the policy really should cover the resident's household, and their guests. And there really should be no exception. So I highlighted that here in all caps because we know it's very tempting sometimes to provide an exception for current residents to continue smoking. But that approach really does defeat the purpose of a policy, and it puts the health of other residents at risk. So we really discourage any exceptions. Next is getting at the what. So comprehensive definitions will clearly identify the what of the policy. A comprehensive definition of smoking includes the whole range of products on the market, and even some that may not be legally on the market in some states, but are commonly used. So this definition I have included here of smoking covers lighted or heated products. There are, not only combustible products, but there are products now on the market that you heat the tobacco. And so that's covered under this definition. It includes a variety of sources of the products, so tobacco, nicotine, generally plant products, and specifically marijuana. And also make sure that it covers both natural and synthetic products. So our definition also clearly identifies electronic smoking devices, also known as e-cigarettes or vapes, because these products do provide harmful secondhand aerosol. So some smoke-free policies provide exception for traditional ceremonial and sacred use of tobacco practiced by some indigenous communities. So to include this important exception, the sentence in the third bullet point could be included in your definition of smoking to be clear that smoking does not include use of sacred tobacco for indigenous ceremonial purposes. And if you want more information on that topic, I've included a web site here to the National Native Web Network's website, keepitsacred.org. So our model policies are 100% smoke-free, meaning that all of the property is smoke-free. The highlighted language here is from our model condo policy and is an example of a comprehensive 100% smoke-free policy that would cover all units, including outdoor areas attached to units and all outdoor areas of the property, including all pool areas, picnic areas, playgrounds, all of the above. But some developments or properties may choose to have a certain designated smoking area. And if you choose to go that route, any designated smoking area must fit within state and local smoke-free laws. So if you have a shelter, you need to check on what the limitations might be there. And moreover, it should protect all residents from secondhand smoke exposure by ensuring that there are clear buffer zones away from the building and outdoor areas that are frequented by other residents. Also, the very limited area and boundary of a designated smoking area should be clearly marked so other residents can avoid exposure. So this brings us to our discussion of equitable enforcement of smoke-free policies. And first, I need to recognize that nicotine is an incredibly powerful and addictive substance. So a key principle behind graduated enforcement is to approach implementation with an eye toward assisting residents with compliance. And that means offering assistance with dealing with their addiction. So a graduated enforcement process often includes multiple steps to enforcement before eviction or other penalties are pursued. Most often these include, cessation support offered. But I wanted to share this slide because the graduated enforcement policy is not in a vacuum. It really needs to be considered as part of a comprehensive approach that includes early education and over communication of the policy, along with offering those cessation resources. So this more comprehensive approach to implementation really helps promote housing stability for all residents because people know what is expected of them and can make clear choices. So there are many different modes of graduated enforcement and several are included in our Public Health Law Center publications. I just grabbed from our model rental lease addendum and from our common interest community condo policy, the examples that we use here. You'll see in these Minnesota specific examples that there are a series of warnings, verbal and written, as well as provision of smoking cessation materials as part of the process of enforcement. One thing you will not see in our rental example is the use of fines. The use of fines, even if they seem nominal or small to you, may have unintended consequences of creating housing instability if residents can't afford them. So contrast that with common interest communities. Fines are a frequent enforcement tool used in the context of enforcement of all policies in common interest communities. So that might be more acceptable in that context. So the last slide I'm going to share for this section is just some resources on cessation, since they are a key part of a graduated enforcement approach. These are just some basic initial ideas of where to find some resources. With that, I'm going to hand it back over to Kara to talk about public policy.
Thank you, Rachel. And hello again, everyone. I'm just going to briefly cover some of the common public policy approaches to smoke-free housing adoption. So there are kind of various levels. We won't talk too much today about the federal level. I will briefly talk about the Department of Housing and Urban Development smoke-free housing rule in a couple of slides. But I'm going to focus mostly today on things that can be done at the local level to implement smoke-free housing protections. Next slide, please. So here are some basic smoke-free housing public policy approaches ranked kind of from order from least protective to most protective. So we'll be starting our discussion with symbolic approaches and then ending with smoke-free housing, clean indoor air laws or ordinances. Next slide, please. So as far as symbolic approaches, these typically take the form of a resolution or a declaration at the city or municipal level. So this could be a city saying, we support smoke-free housing and we're going to create a resolution or a declaration to promote this. There are a few pros and cons to this approach. A few pros to consider. These tend to be pretty easy to implement. Decision makers like having something positive to promote. This can generate some good media as well. It also educates the public, so a really great, easy tool to spread the word about smoke-free housing, and demonstrates city-level support, which can kind of serve as a launching pad for additional smoke-free housing work in the future. A con, of course, may not lead to policy change, but it could. So a pretty easy low-hanging fruit, but an option and a couple of pros and cons to consider. Next slide, please. Another option that we're seeing an increasing number of communities adopt are incentives for smoke-free housing policy adoption. So this could be an example of a license rental fee decrease for the city. I'll just point out not all cities have rental licenses, but if they do, this is an option. So it could either be to decrease the rental license fee, or for example, if the fee is increasing, keeping properties with a smoke-free policy at their current rate. Another example could be if there is some sort of affordable housing application, that there could be a point awarded, or it could be a requirement to go to be smoke-free. So again, adding additional points would be an incentivizing on a request for a proposal to developers to make their smoke-free housing right from the get-go, to make their new housing smoke-free right from the get-go. Some pros: additional properties may go smoke-free. There could be an increase of revenue for the city. And this, as I mentioned, could be a stepping stone towards a more comprehensive smoke-free housing policy moving forward. Some cons of this approach: again, not necessarily a guarantee of policy change. There could be some potential opposition from city staff, and also some potential opposition from property managers. So some food for thought for this approach. Next slide, please. In terms of disclosure, and there are a couple of places within the United States that have already adopted this. One prime example is New York City, but this is an approach where either the property owner would need to disclose, if, for example, in a rental community, what the smoking policy is. So either there is a policy or there is not a policy, to a prospective renter before they move in. We're also seeing this increasingly in common interest communities like condo, at the point of sale. So the seller would need to disclose to the potential buyer what the smoking policy is for the building before that point of sale. There are a number of pros and cons to this approach as well. Again, providing education and information is helpful. When we see this in a number of other public health initiatives, including lead-based paint. So this, raises awareness of the importance and the legality of smoke-free environments, may reduce legal liability exposure for owners and managers. This could potentially result in new voluntary policies. For example, here in St. Paul, Minnesota, a disclosure policy was recently passed at the city level for condos, and we're seeing a lot of interest in condos currently to adopt a smoke-free policy before this new disclosure law takes place. Another pro, it may allow residents to seek redress in case there is a smoke-free policy violation. On the flip side, again, it may or may not result in new policy adoption, potential opposition from owners and managers. There's potential that a disclosure policy could stall new, stronger policy initiatives. So for example, an owner of a property might say, well, I don't need to implement a policy because residents moving in knew what the smoking rules were when they moved in at the time. So, to that vein, a potential reduced likelihood of relief for residents being impacted by secondhand smoke, and kind of on both sides of the coin, risk of alienating potential renters, both non-smokers and smokers. So pros and cons to this approach as well. Next slide, please. And smoke-free housing ordinances is really, I think, all of our ultimate goal. We want to make sure that all of our communities and all of our housing is free from secondhand smoke. So some examples of a smoke-free housing ordinance, what we've seen so far in the United States are all at the city and county level, predominantly all in California at this point in time. But we're really seeing kind of a spectrum of requiring all rental housing to be smoke-free, ranging to all rental housing and all common interest communities need to be smoke-free. So pretty broad spectrum of what smoke-free housing ordinances currently look like within the United States. Some pros of a smoke-free housing ordinance approach, broad resident protection from secondhand smoke exposure, positive social norm change community-wide. We want to set a good example for younger kids and generations that, smoking, it needs to be taken outside. That's not something that we do indoors. It levels the playing field for property managers and owners hesitant to voluntarily adopt a policy, right? So they can point to somebody else and say, don't be mad at me. The city's doing it or the county's doing it. It also ensures equitable distribution of public health benefits of smoke-free housing environments. So, currently we're seeing some inequities between, higher income buildings having smoke-free protections and lower income buildings not having as many smoke-free protections. So an ordinance or a policy levels the playing field because the same rule would apply to everyone. Of course, there are cons with all policy changes, pros and cons to all policy changes. So, some cons to a smoke-free housing ordinance to consider would be, enforcement could be challenging for cities or property owners and managers, again, depending on the scope of the policy, what that policy looks like. There could be a lack of technical or financial support available for effective implementation. A successful policy is only as good as how well the policy is implemented. So making sure that those support resources are available can be challenging for some communities. And also potential opposition from housing advocates, managers, and community groups could be a challenge as well. Next slide, please. I just want to touch briefly on affordable and subsidized housing. I mentioned earlier the HUD smoke-free rule. So currently all public housing nationwide is required to be smoke-free. There are also other avenues. I mentioned earlier incentive-based options. So, one example, the low-income housing tax credit program, which is nationwide, and a lot of qualified allocation plans or for sub-allocators, they do offer, some communities offer a point. Some communities offer lots of points and some communities require it. So another avenue to incentivize or require smoke-free housing. There are a lot of public housing agencies that are pretty proactive on smoke-free housing as well, and have, kind of preempted the HUD rule, implemented their own policies, and have gone more broadly to involve their other types of housing and subsidized housing as well. Next slide, please. Americans for Non-Smokers' Rights has a really great database of local laws. So I'd encourage you to check out nosmoke.org. And they have a list of all of the current smoke-free housing ordinances within the United States. And they update it pretty regularly. So again, nosmoke.org, I'd encourage you to check them out. And with that, I will pass it back to Rachel.
Great, thanks again, Kara. That was a great overview, and I'm going to provide a little deeper dive, but still a pretty high level overview into some of the key policy elements for a comprehensive smoke-free multi-unit housing ordinance. And the next slide depicts an image of a great model ordinance that we have created for the state of California, building off of the previous work of Change Lab Solutions and their great work on this front. So I'm going to be using this as our opportunity to kind of walk through some of the key elements of a policy. So what you'll see is in our model policy, you'll see that, again, we have a comprehensive definition of smoking that covers tobacco, other substances, including marijuana and cannabis, as well as e-cigarettes. It covers the whole range of multi-unit housing establishments. So apartments, condominiums, townhomes, the whole range, and also new and existing. It prohibits smoking in 100% of individual units, so no exceptions. It also covers all balconies and patios, all common areas, indoors and out. And it does not allow for specific designated smoking area, although we do have some language that could be plugged in to allow a very limited designated smoking area if the community decides that that will ease or assist with ultimate implementation and compliance. So, but again, just to emphasize, there should be no exemption for existing residents, similar in that to the private context. So in the next slide, I highlight the importance of having a very thoughtful approach to enforcement. And this approach would really attempt to minimize potential impacts on housing stability. As Mike noted earlier, that housing is a linchpin in the social determinants of health. And so we need to very carefully balance the interests of housing stability and protecting people from secondhand exposure to smoke. So the language in our model focuses on a range of potential enforcement mechanisms. It really has multiple layers of enforcement. Enforcement would be put into the hands of public health or Department of Inspections, not police. And a key thing I want to highlight is that we have no criminal penalties in our model policy for the very important reason that criminal penalties can put people's housing stability in jeopardy and create a cascade of a lot of other issues related to criminalization of low-level offenses. So in the next slide, here are some of the considerations that we weighed as we created our model policy. So carefully exploring any unintended consequences, avoiding police involvement in enforcement. And I can't emphasize enough that our goal is always compliance. So, you know, avoiding steep fines or purely punitive penalties, making sure that there are notice, warning opportunities, and of course, support for accessing cessation materials and resources. So you'll see how these are all incorporated in our model. And the next slide, most ordinances do use some combination of these types of multiple enforcement mechanisms. Unfortunately, there's not a perfect solution, and it really is going to depend on the community for how you want to, you know, enact and implement these policies. So you'll see here that on this slide, I did cross out the criminal penalties because we do really firmly believe that criminal penalties in this context are not appropriate. So the next slide does explain some of the administrative penalties that a municipality may enforce. And, you know, penalties at the administrative level often include fines, but they could also include diversion. And some of the California communities do have that option in examples that we've seen. But typically a process would involve a complaint to the city staff about a smoking violation, and then the process would be triggered through that. So moving on to the next slide, a lot of communities also require some level of obligation for enforcement by a homeowners association, property managers, and landlords to enforce elements of the smoke-free policy. So often these are very explicitly spelled out, and they should be in the ordinance. So the responsibility of these homeowners association landlord would be to provide written notice, posting signage, and then ultimately to take reasonable steps to investigate and enforce the policy. So these obligations absolutely should be clearly spelled out in the policy, as we've done in our California model policy. So in my last slide is just to note that there also can be some direct resident enforcement steps that can be taken. I already talked about a citizen complaint process that's part of a lot of ordinances. But another layer is to strengthen the hand of an individual resident to support an individual cause of action or lawsuit that they may want to file for damages or injunctive relief, and using the ordinance as evidence of ordinance violation as part of the evidence for that case. And with that, I am going to hand it back to Mike, and we're going to try and pack in a few questions in our last 5 minutes here.
Sure, thank you both. We may go a little bit over time, just answering some, but we want to make sure we answer all of your questions. If you have to leave, obviously feel free to do so. This will be recorded, and if we haven't yet gotten to your answer by the time we have to leave, you can review the recording of the slide also, of the webinar also. So, but first, just a couple comments that were posted in the chat. There was a comment from Irene about third-hand smoke, and she noted that the Third-Hand Smoke Resource Center at SDSU has lots of great resources about this topic. So thank you for sharing that resource. There was a question from Liran in the chat mentioning policy efforts in Israel, and it's very exciting to hear about those policy efforts. Liran shared an article about the efforts and asked for examples of other policies. We work mostly in the USA, so I don't have many examples from other countries. Kara mentioned the document showing policies in the USA. Most of them are at the city or county level in California. Liran posted an email address if you do know of other examples. If you could send it, that would be great. So the first question is for Kara. Somebody who wrote in advance asked the presenters to describe enforcement mechanisms and funding. And regarding enforcement mechanisms, I know one question we often get is how do you prove somebody violated a smoke-free policy without going into apartments to find the source of the smoke? So if you're able to comment on that, that would be great.
Yeah, that's the golden question. We get that one a lot too. So I would say it's really a best effort, and it's really multifaceted. So you know, a property manager cannot be at a property 24/7, you know, to observe everything that happens. So making sure that anyone that's on the property is well educated about what the policy is, what the policy details are, you know, what to do if they encounter a violation. So that includes residents, that includes maintenance staff, that includes social services, that includes guests, you know, making sure the policy is clearly demonstrated so that there's signage up. You know, if there are maintenance staff who are going into a unit, you know, and they have permission to go into the unit, they can, you know, write down any signs of smoking that they see out in the open. So they can't, you know, open drawers or go in private places, but if they see evidence of smoking, that can count as a violation. You know, if their manager sees or smells smoke, so for example, they knock on the door and someone opens the door and they're smoking, you know, that can count as a violation. So it should be outlined in the lease what counts as a violation. We do have, I know the Public Health Law Center has as well, some example policy language that can be included in a model policy that says, you know, evidence includes, you know, finding trash, refuse within a unit, or 3 complaints from an adjacent unit or a neighbor, maintenance staff noticing things. So all of these things can count towards evidence that can be contributed to that kind of smoke-free policy enforcement process.
Thank you. So I'm going to try to move through these quickly, I think. So this question I think might be a good one for Rachel. Somebody wrote in advance and asked if we could address cannabis. And there was a related question in the chat from Anna Maria, who asked, can property restrict smoking marijuana under the same policy, even in states with legal marijuana laws?
Yeah, in most cases, yes. So I think, you know, we get this question a lot, and there is no right to smoke. And in most jurisdictions, that is the case. So, you know, our model policy does include a definition of smoking that includes smoking of cannabis or marijuana, and that's regardless of whether it's for medical purposes or recreational purposes. But you would want to check on your own local laws to make sure that that abides by any restrictions at the local level.
Thank you. There was a question from Lisa in the chat who asked, could disclosure include when you sell a private home, disclose if someone smoked in the home, as there could be third-hand smoke remaining in the home? Rachel, do you want to talk about disclosure?
Yeah, so some jurisdictions do require disclosure before sale, or, you know, you could do that at the private, you know, in an HOA circumstance as well. But yeah, I mean, that's a really important point. And I know Kara actually worked with the city of St. Paul here in Minnesota to require disclosure before condominiums were sold or common interest community units were sold. So that's definitely an important option to give full disclosure so people can make a decision about whether they want to live in an environment where smoking did occur.
Okay, and there's questions coming in on the chat as this is going forward. So I just so people know, I do see them. If I'm going to try to incorporate them, but if we aren't able to get to them, please shoot us an email. Shoot any of us an email. Our contact information should be here. So feel free to ask us personally as well. So there's a question I think would be a good one for Kara. This was submitted in advance. What cessation drugs are used for people who start smoking at age 15? Do we have youth cessation classes?
Good question. Youth, and I guess I'll just preface this by saying I'm not a certified cessation counselor, but based on what I know about cessation resources that are available for under 18, typically it's recommended, especially if there is not a significant nicotine addiction. Therapy and talking with a counselor is typically the route that is advised. So there are a number of really great resources out there. For example, I just heard the American Lung Association has a new program out for teens. I know that CDC has a lot of great resources for teens. Here in Minnesota, our state quit line, quitpartner.mn, they have a program specifically for teens. So I'd encourage you to check out your local quit line. They can point you in the right direction. 1-800-QUIT-NOW if you're in the United States. As far as nicotine replacement therapies or NRTs, there are some physicians that do write prescriptions for teens younger than 18 if they have a significant nicotine addiction. But again, I would encourage folks to speak with their particular physician to talk more about that.
Thank you. There is a question submitted in advance. How can we include vaping and other emerging tobacco products in our tobacco-free policies? Don't know, Rachel, would you like to take that?
I think I pretty much already addressed that in my comprehensive definitions, but if you use a comprehensive definition of smoking, it should include all of those products that exist, so including vapes and e-cigarettes, but also these heated products that are coming on the market as well. Be sure to use a very comprehensive definition.
There was a question from Andrea in the chat. I know you talked about this a bit, but maybe you could expand on it a bit, either one of you. Why not include fines in HOAs? That is typical means of enforcing other HOA violations after X number of warnings. That also ensures that someone who rents out their unit will make sure the tenant follows the CC&Rs. I don't know if you have any comments on that.
Yeah, I think in our version of the condo policy, we do allow for fines in that HOA homeowners association context. But again, thinking about balancing the severity of fines to make sure that you're not throwing someone's housing stability into jeopardy would still apply in that context. So I think, taking the multiple steps to provide the policy to ensure written warning, verbal and written warnings, so that you're paving the way towards compliance before people are hit with a fine, that's the basic principle behind a graduated approach.
Thank you. I think I'll do one more question and I'll throw it to Kara. This is from Patrick in the chat. Is there a technological solution to the enforcement challenge? Is there such thing as a smoke detector that could be installed in residential units? By smoke detector, I mean something that would detect someone smoking, not smoke from an actual fire. The smoke detector would silently notify the building owner or manager.
Great question. We receive this one a lot as well. So I will say there is a group in Colorado called GASP that has put together a list of smoking detectors, if you will. A few things I want to point out. Unfortunately, the jury is still out on how effective they are actually in an eviction type of a setting. In terms of their efficacy, there are a few that work better than others. You know, we don't particularly recommend a specific one. You know, from a legal perspective, you know, what I've heard is, you know, you want to make sure you're putting one in every single unit. You want to avoid any sorts of discrimination complaints or that might come from like putting a device in one particular unit and not everyone's. They can also be really costly. They can be very, very expensive to put in one unit, let alone all of the units. So, you know, there again are some pros and cons. I can find that list and can put that in the chat box for you from the group in Colorado. But just a few things that I want to highlight from that.
Thank you. I think that's all the time we have. Time we have for questions. That's what I meant to say. And I apologize if we didn't get to your question. Stephanie posted our email address. That's our general email address for the Public Health Law Center. I know Kira's contact information was on a slide as well. All of these slides will be posted in addition to the video footage of the webinar on our webinars page. So thank you for all the great questions and engagement and for attending our webinar, and look forward, keep an eye on our page for webinars in the future. So thank you very much for your time.